Tell me about the program that you run, where it is, the types of populations you serve.
Sure. Our public housing primary care program is located in Atlanta, Georgia. We're an urban setting. We have been providing primary care to public housing residents for 20 years now. We were one of the original grantees. However, even before we were awarded the funding to provide primary care or provide access to care by taking healthcare services into public housing communities, we were already strategizing how to reach the population that was pretty much isolated, were not receiving care anywhere else. If so, it was fragmented or it was emergency room episodic care that they were receiving. So when we received the funding 20 years ago, we had already garnered the trust of the communities, the public housing communities, that we had targeted to go in to improve the health care in those communities. And over the years, over the 20 years, we've been in several public housing locations on-site in communities, working with actually 3 different housing authorities in Atlanta, both in the city of Atlanta, the county of Atlanta, and then a suburb area. So we've seen quite a bit of change. We've also seen a number of impacts in the patient care of the residents that we've served in the communities.
All right, why don't we go into that right now? If you can think of any particular success stories or some particular impact that you may have had on individuals or just generally on the community you serve.
Okay. Well, initially, I think of the impact being economic. We were able to hire residents from the community, meaning that we were able to employ and have seen residents that have worked for us to flourish and move on to other productive jobs, and we're very proud of that aspect. Not only did it provide a service for them economically, but it provided a service for us because that was our link or our pulse on the community to bridge between health services and the community. What better way to serve a community than to actually have someone who lives in the community work on our staff. Of course, many of our staff became entrenched or part of the community. It wasn't just a 9 to 5, but we actually were involved in aspects of the community life, be it family day that were going on the weekend, be it resident association meetings in the evening, graduations, several things. We actually became an extension of that community, and that extended far beyond from our nursing, outreach, medical doctors. It was a holistic approach of having residents become a part of the health center. I often think how the birth of our teen clinic started in that students would just stop by after school in one of our locations to talk with our physician assistant. They got to know a physician assistant, what it took to be a physician assistant. And there were people in these professions, be it nursing, be it medical records, be it the physician, who often looked like the people that we were serving. So it didn't seem so foreign for them too that they could achieve and be that. But just through the talking and the being part of the community, teens just started stopping by the health center after school. And from that blossomed rap sessions on health education aspects. And it was a very comfortable environment for them, one that was spearheaded by someone that genuinely cared about seeing them grow and develop in many aspects of their life, not just coming in to be treated for the pathology that was presenting, but actually concerned, how well are you doing in school? What's your summer going to be like? How many books are you reading over the summer? So it allowed us to enter into the lives on a holistic way, not just the health care.
All right, and that's important on another level. I mean, one of the things about serving these populations is creating a trust, right? So
Absolutely.
So that's a barrier. So tell me about some of the barriers that you found in helping you achieve your goals for your center.
Well, I think, and I've often said that there are competing priorities for the communities that we serve. We as the healthcare professional have our priorities of increasing the health. I mean, we want to decrease or manage hypertension, diabetes, asthma, that list that we're all so familiar with. But in order to make that impact or to decrease a barrier to do that, we have to see what their priorities are, whether that priority is is daycare, whether it's to find a job or whether it's to get into a GED program or to go on to some other type of education. Those are real barriers, and in the communities, oftentimes the resources are not there that are needed to help and support the families. So it's really a meshing of the priorities and eliminating those barriers that may prevent us from actually treating the health care of the individual. And you know, it's often like an onion that you have to peel the layers of an onion before we're able to really get at the root of what's causing the illness. The illness may be a symptom of so many other things that are going on in the community that they have to deal with, the stressors, violence. We've actually seen a great deal of violence. It's changed over the years for the better. But initially when we went in, there were very deliberate gang violence. We became a part of the community, so we were often looked after or were told when something was about to happen. But I must say that over the years, that has really changed dramatically. I've seen a great deal of improvement in physical structure, in the environment in itself. Still have a way to go with green space and all those other things with food deserts. We still have a ways to go, but it does our heart good to actually see that there has been some monumental improvement by us being there and being a part of that change.
Now, just about every question you've answered, you sort of answered this last question, but let me just ask you if you can sum up for us what the importance of having these health centers in these communities. What is the true importance of them?
The true importance is to make healthcare accessible. Many of our centers, we're located in the physical structure of public housing. Some were located across the street, down the street. We even have mobile services. But the common thread is accessibility. But even though we're located, say, perhaps in a building or in a unit, that's not guaranteed accessibility. You still have to extend beyond those four walls of where you're practicing medicine. So I say accessibility, but I'm really not talking only about a physical structure. I'm talking about how engaged we are in the community, how that trust, how well we know what the needs are. For example, some of the senior facilities that we're located in, public housing, senior high-rises that we're in, we have to know what it is that they're facing, not necessarily what we have identified that seniors have risk factors regarding, whether it's depression, isolation, whether it's socialization, but in some way we weave that in to providing health care, to get your blood pressure checked on a regular basis, to have your medications brought in and identified so that we can see exactly what you're taking. But that doesn't just happen, and we can't hang a shingle on the door and say, you know, come and do these things. Outreach is a key component. Community health workers play a vital role in what we do. So I say accessibility is number one. But I also see why we do what we do is to bring about an awareness that exceeds beyond the health care. Often what echoes in my ears, I hear a patient that was newly had his hypertension managed. And he said, I didn't know I felt so bad until I started to feel better. So it's almost like being numb to the existence that you have until there's an unveiling or an opening of your eyes that there is something better. I can feel better. I can do. And all of that comes about by being there and taking health care to people where they're able to connect in whatever way it is that they need to connect in.
Great. Thank you. That's fantastic.
Oh, thank you.